Great. Welcome, Dr. Khan, to Healthtech with Purpose.
Thank you. Thank you for inviting me.
Yeah. So, how's Chicago so far, and how's things going on?
Chicago's crazy weather.
Yeah.
Sometimes it's summer, next day it's winter. So that's interesting. I mean, HIMSS has been. I'm surprised to see how big it's become. I
Yeah.
remember the days when only be 5,000 attendees, and now it's out of the keynote this morning, you couldn't even go through the corridor, so it was pretty packed. Yeah,
Yeah. Yeah. So, Dr. Khan, we would like to know a little bit more about you. So,
sure.
why don't we start with your quick introduction?
Yeah, sure. I mean, I'm Khan Siddiqui. I'm currently the Chief Medical Officer and Chief Strategy Officer at Hyperfine. Hyperfine made world's first portable MRI scanner that is FDA cleared. My journey started long time ago in Pakistan. Went to med school there and moved to the US for my training. Did my training at NYU and at Geisinger Health System.
Great.
Became a radiologist, but was from day one very interested in health IT and software, and all my academic research work really focused on computer applications in medical imaging. And at that time, I thought that there should be a dedicated training program that combines imaging and technology together. So convinced University of Maryland to start United States' first imaging informatics fellowship program. Led that program for a few years. I trained most of the radiology IT leaders in the country. And when I moved to University of Maryland, this is 2003, I think.
Yeah.
My interest in academic research became all machine learning.
Nice.
So these are early days before nobody was even talking about AI, and then from there I got recruited by Johns Hopkins, so moved to Johns Hopkins as director of biomedical imaging informatics, and a lot of the early work I did in machine learning in those days, and then got recruited by Microsoft in 2007 timeframe,
Great.
and spent 4 or 5 years at Microsoft working in different capacities in healthcare, leading medical imaging, leading AI stuff. Um, 2012, left Microsoft to start my next startup called Higgy.
Okay.
So Higgy is a medical device slash population health hypertension management company. So we did deliver hypertension management solution through kiosk in grocery stores and pharmacy.
Okay.
Scaled that to 12,000 devices deployed in North America,
Wow.
about 60 million patients on the platform. And then we exited as part of we were acquired by Babylon Healthcare as part of their 4.2 billion SPAC transaction. And then since then, I've been on the board of multiple different companies, helped former employees launch theirs, and working on Hyperfine.
Great. Great.
Product.
Great to meet you. Great to have you
Sure.
here. With all that you have done so far, amazing journey, I would say.
Thank you.
So, can you give us more details about Hyperfine and what's the solution about, and just to understand a bit more.
Yeah, the Hyperfine really started. It's a very mission-driven company, and the company is founded by Dr. Jonathan Rothberg in 2015 with this idea that how do we get MRI scanner to the patient's bedside,
Yeah.
and how do we do it in a cost-effective manner so that we can make imaging accessible to the globe.
Interesting.
91% of humans don't have access to advanced medical imaging.
Yeah.
And so that's what the mission was and how we can approach it. So first few years really, because this is a very challenging problem. We had to invent a lot of different things to even make it possible to do imaging at a patient's bedside. If you think of a traditional MRI scanner, it requires a Faraday cage.
Yeah.
It's so sensitive that it requires copper uh, shielded rooms so that interference from external environment don't come into play. It requires special air conditioning system to maintain temperature. It requires special light fixtures
Yeah.
because they all interfere with everything else. And then plus because of the magnetic safety point of view, you have to have special devices, special instruments in the room. You can't just bring anything in. You can't bring a bed in. You can't bring an oxygen tank in the room. So there's a lot of complexity around that. Most of the traditional MR scanners are built using superconducting magnets. So
Yeah.
they require helium, which is very expensive, or some other rare gas to cool the magnet down, and it requires power as much as a nuclear submarine does just to get the the temperature down for the superconducting magnets to work. So we had to think through like how do we do this?
Yeah.
How do we image without a Faraday cage? So we came up with this noise canceling technology to cancel out environmental noise, same way headphones cancel background
Interesting.
noise, right?
Yeah.
We had to think through, we couldn't use superconducting magnets because that would have been cost prohibitive plus the infrastructure needed for that. So we moved to permanent magnets. So how do you then figure out what the right ore of a magnet is to be able to do this? And we had to have such a low field strength so it was safe, and we wouldn't have things flying around the room because of the magnet. So we went down to a ultra low field, a 0.06 Tesla. A traditional MR scanner is about 1.5 Tesla.
Wow.
So ours is 0.064 Tesla
That's interesting.
unit. And then, putting it on a wheel and driving it around inside the hospital and making sure it's safe. So it required a lot of these inventions. The biggest challenge doing this is very low signal to noise ratio.
Yeah.
But what has happened is there has been 40-fold increase, advancement in electronics, in compute power, in image processing techniques, AI, all the stuff. So we took advantage of all those things to be able to then generate images where the SNR is so low on these image, and using really deep learning based reconstructions to create image diagnostically. So the vision really was to make this possible, and it felt impossible. And we always say that there are three stages of a product. First is impossible to do, then it's become difficult to do, and then it's done.
Yeah.
So, and that's how it was. And now, the device is cleared in the US and Canada, UK, Europe, Australia, New Zealand, and expanding globally also.
Nice, nice, nice. So, what's the overall strategy? How does a patient kind of use the device? Like, what's the first point where they are get introduced to the device?
So our commercial focus has been neurocritical care,
Okay.
neuro ICU or ICU where the brain
Okay.
is somehow affected. The reason is that we looked at all the possible scenarios where MR can be used, and we looked at who are the least served population in a hospital.
Okay.
And the patient in the ICU that has some kind of brain trauma, brain injury, stroke, or whatever it is, that patient is very risky to move. They're in the ICU, they're on the ventilator,
Yeah.
multiple equipment on top of it, and to move them, it's expedition.
Yeah.
Right, you need a nurse going with them, the doctor needs to go with them, respiratory therapist, whole team needs to go
Yeah.
down to radiology, and takes 2 to 3 hours to get these imaging done. So that's what we focused on. These are the most patients that will have the most value from it, and that's how we commercially focused on. Yeah, I mean, there are a lot of use cases, there are outpatient use cases, pediatric use cases, but our commercial focus has been in the US and North America, basically, is ICU as the
Interesting.
primary beachhead.
Okay.
And, it's a brand new device, brand new category, so it has to go through this diffusion of innovation.
Yeah.
Normally happens, the innovators, the lead adopters, the lead majority type of thing. So we are still in that, early adopter kind of phase of it, where a lot of people are using it, developing evidence around how to properly use the device, what are the benefits of it, and things like that. I think what I'm really excited about the future around the device is that our strategy was to make images look like how 1.5T images are supposed to be, so that we shorten the learning curve.
Yeah.
But we haven't taken advantage of the properties of ultra low field, which are different, where you can actually do things that a high field examiner cannot do. But that means brand new techniques, and it'll take a long time for people to understand what that means and
Yeah.
learn. So I think I'm really excited as we go into that direction and start building techniques that are taking advantage of ultra low field. That is going to be when things really will be exciting for the
Yes,
device.
yes, yeah, and I mean, the amount of innovation that has gone into it, after listening to that amazes me, right? It must be. So, what was the, when did you start putting things together, and how much time did it take to kind of actually bring the product to reality?
Yeah, so I think the first 2 years was just R&D experimentation to see how can we solve some of these challenges
Yeah.
we have. And I think 2017 was when we kind of figured out the architecture and what's going to be.
Nice.
And then there were a lot of iterative approaches. There's classic iterative development. What will it take to get it to where it is? And then in 2019, we submitted for our first FDA clearance,
Okay.
and rest is history.
Amazing,
Yeah.
amazing. So, help us if there are any cases today that are using this, and what's the impact it has caused. Like, if there is a case study that you'd like to share, and like the old ways versus the
Yeah.
hyperfine way. So, would love to
So
understand
in
that.
multiple use cases, I mean, they're all on our website.
Mm.
People can take advantage of it and look at it. But I'll tell you what the one that excited me a lot,
Yeah.
right? So we had a request from Raising Malawi Foundation to to buy a scanner for in Blantyre, Malawi, in Mercy St James Hospital. The entire country of Malawi did not have an MRI scanner,
Wow.
zero
Not
scanner.
even the normal ones.
They used to have an
Okay.
old one that broke, and then at the
Okay.
time, so patients were driving, 500 miles to South Africa for imaging.
Wow.
So that was, but their request came in during the pandemic. So how do you deliver a scanner in Blantyre, Malawi,
Yeah.
without send anybody going there?
Yeah.
So having some of the one of the clinicians from that team who was based in the U.S. going there, getting them to Connecticut to our head office, training them how to get the scanner out of a crate, how to operate it, things like that,
Yeah.
and then being available over Zoom to help them where bandwidth issues are there, all
Yeah.
the stuff. But they were able to get the scanner off the truck, uncrated, and scan the first patient 4 hours after delivery,
Wow.
which is unheard of, right? Typically,
That's
MR
that's
scanner,
yeah.
when it's put in the hospital, takes months,
Yep.
if not weeks, months to deploy and then do scanning. But that was just like unbelievable to see. And that patient that they scanned, they were suspecting cerebral malaria. The MRI scanner showed it was not cerebral malaria, but it was what is called posterior reversible encephalopathy syndrome. And all you have to do is control their blood pressure, and patient recovers. The kid woke up in 48 hours while he was in coma and was discharged.
Wow.
Right, so
That's
making
like
that
a
impact
yeah.
without actually sending anybody to train or deploy the scanner
That
was
is amazing.
probably the my number one. I mean, there are hundreds of other stories
Yeah.
in the ICU, how we make a difference. Testimony from patients, testimony from family members, and how much it has made a difference. But I think for me, that was the
Amazing. And
delivering.
that's very very interesting because, as you rightly said, right, the time to actually start using the
Yeah,
device, and that too, I believe in such conditions, not without too many medical experts being around setting it up,
yeah,
and
exactly.
that's amazing. So, in this journey, what are the challenges that you faced, especially while building the whole tech?
Um, Challenges to the whole tech. Um, I think that if you think of challenges more of um, I would think challenges more of brand new technology, right? New
Yeah,
technology adoption,
awareness.
awareness around the stuff. So if I think of it, right, the need for the device is more in lower middle income settings,
Okay.
but there is no good playbook on
Yeah.
how do you launch a device first
Yeah.
in LMIC settings. Because in LMIC settings, when you go there, everybody's looking. They're so used to people already have used device. There's evidence how to
Yeah.
use it. What standard operating procedures have been defined. So when you go and try to sell a brand new device in those areas, they ask those questions like, "Hey, how do you use it?" I called my friends in UK; they haven't heard of this.
There's a
You
new
know,
vertical that's been
Is-
getting created, kind of.
exactly right. So a lot of time as we think about LMIC settings and we focused on US as a commercial entity because of the same reason because we saw a lot of resistance in LMIC settings because they just uh, didn't have that early adopter mindset that need to be developed. But I think that needs to change. I think it is changing, but it's going to take time to change. So I think the challenges have been more around that aspect of it.
Got
Making sure we identify the right early adopters and they understand that they're helping define what the standard operating procedure of this technology is and how to use it. Um, Device is a very simple device, to be honest. Once you figure out how to solve the big problems,
Yeah.
then it's a magnet with a PC inside it. It's collecting the signal and you're processing them and generating images, right? So, I mean, tons of patents and a lot of things to do it, but at the end of the day, simple solutions are always the best solutions.
Yeah.
And I would say, like, sometimes it takes, to get out of the existing mindsets.
Yep.
The analogy I use is that why is Tesla build the first best electric car, and why didn't the car manufacturers
Yep.
did? Because they couldn't get themselves out of the combustion engine.
Yeah.
So they could think of a hybrid vehicle, but not a total electric vehicle. So same thing here. And when you think of MR, everybody thinks of that you have to have homogeneous magnetic field,
Yep.
right? And because every MRI scanner is built on site, the magnet is built on site to make sure it's perfectly homogeneous. We had to throw that out the door because we could be parked next to a gigantic pillar with iron in it, steel in it, and it would distort the magnetic field.
Yep.
So once we threw that out, then suddenly like, oh yeah, then we don't need this, we don't need this, we don't need this. Okay, then we had to figure out how to correct those distortions, right? So it became a very different problem to think about, and those were the challenges, just to figure out how, as you're removing constraints that were there because of what a high field is thought of, and then once you remove them, then opportunities just opened up to
Very
solve them
interesting.
different ways.
Yeah. And as you rightly said, like because this is a new vertical, probably the challenges are not same as that you would probably get to build a normal MRI machine, right?
Yeah.
So one interesting thing that I feel, and correct me if I'm wrong, but since you have taken this different approach to solve a certain problem, right? How do you see the use of AI coming into play? Because now you have a custom built device that you control in a way, how it should work, right? And once you get images, do you see certain computer vision or certain AI, and then showcasing recommendations that, hey, the system feels that this could be the problem, or maybe with this certain scan,
Yeah.
in 3 months, 6 months, 9 months, there could be certain issues. Are you looking going down that path?
Yeah, so I think our first approach to using deep learning based techniques on our device was just improving image reconstruction, right?
Okay.
So instead of using the classic fast Fourier transform that everybody else uses, or use compressed sensing and other image processing techniques, we actually build a deep learning neural network
Oh wow.
to do image reconstruction, right? So we take the low signal raw data coming in case space and convert that into image using a deep learning based neural net. That was the first. So every single scanner is relying on that deep learning based reconstruction,
Nice.
as well as denoising that we do, all based on AI.
Yeah.
Then we came up with clinical applications. So patients, because these are scanners are being used in the ICU,
Yep.
the likelihood for an ICU doctor or nurse to receive the images before a radiologist does is pretty high.
Yeah.
So what are the things they need to know immediately that we can
Nice.
show them? And then we built AI-based application called Brain Insight, where it detects volume of ventricles, like if the ventricles are increasing in size in the brain or not, as well as midline shift, there's any pressure coming. So we launched that. It was cleared through FDA. Challenge in these scenarios always becomes that because new device,
Yep.
we start to collect data. You need data to build models, right?
Yeah.
So if you're building a model for any clinical application, you need thousands and thousands of patients already scanned on that,
Yep.
right? We are in that early stage that we just don't have that yet,
Yeah.
right? You could do synthetic generative AI to create those models, but you still need the ground truth data
Yep.
to do that stuff. So I think as you see, as we adoption happens, as we hear from our customers what the needs are, we will enhance our Brain Insights application to provide more and more of those clinical
Nice.
solutions. So today's our focus has been near ICU and the care delivery around that stuff. So,
Awesome.
yeah.
Awesome. Pretty interesting.
Mhm.
How do you plan to scale this up? What's the strategy?
What do you mean by scaling in terms of?
More and more people using it, more awareness, and is it by geography, or by enhancing the tech? So what's the plan overall?
It's all of the above, right? So I think the idea of any startup that starts first,
Yeah.
you have to narrowly focus to the initial customer who has the or population who has the high who's the least served or most underserved and will see the highest value because initial commercial activity is all about with early adopters innovators about they buy because they believe in the value and the mission
Right.
of the
Yeah.
company. They like these are the people who bought iPhone when battery didn't last a whole day, right? And there were no apps on it
Yeah.
because they believed in being different the way
Yeah.
Apple was. Same
Yeah.
thing here, right? So you have to be very focused on that. And as we get into the early adopter to early majority phase when this becomes routine use. That's how you scale around that aspect of it. So our focus has been North America to get to that early majority there, in parallel activities happening. So,
Nice.
how do we optimize it so that it can do pediatric imaging? Even though it's clear for pediatric, but we need dedicated optimal sequences for our peds. We need dedicated optimal sequences for stroke imaging. We need dedicated optimal stream. What about beyond brain? So those are a lot of R&D activities that we do to figure out what our
Nice.
next. So it's not just expanding from ICU to other settings.
Yeah.
So general ward, outpatient settings, other scenarios, but also adding clinical applications on top of it. So it's pediatric, stroke, and other use cases around that.
Got
So
it.
then you exponentially increase because both your care setting is changing, increasing in size, as well as the use cases in those care settings are
Yeah.
increasing in size.
Yeah. Pretty nice. Okay. Awesome. So coming to one of the last things that I would like to
Sure.
know. Uh, so what is the purpose, and what is that? Where do you want to be basically?
Yeah. So I think our mission is to democratize healthcare by making diagnostic imaging accessible to the globe.
Awesome.
Right. So as part of that, we partnered very earlier on with Bill and Melinda Gates Foundation to figure out how can this help in the LMIC settings. So one of the challenges that Gates Foundation had was that they're trying to address two big goals. One is school readiness and academic achievement, especially in the female child. And what are the causes behind it? So the initial focus they had was all on communicable diseases, malaria, diarrhea, and all that stuff. But now that being addressed, the next level of stuff's coming in, which is malnutrition, anemia, and their impact on stunting or brain development. But we don't have good biomarkers. So how do you understand if a baby's brain is growing today, right? Measuring head circumference just doesn't do it. It doesn't show white matter maturation, things like that. So can we use MR to develop biomarkers to understand brain development so that we can have the right interventions uh, happen in those early child birth of the child and grow that stuff. But those biomarkers don't exist, right? And so with our device, it became possible to do this. And so they have deployed 45 scanners. About more than half of them, about two-thirds of them in LMIC settings. So in India, Bangladesh, Pakistan, Sub-Saharan Africa, Uganda, Malawi, Kenya, Botswana, Zimbabwe, South Africa, all of these places where there are actually intervention trials happening where nutritional or anemia or hypoxic injury, brain injury during childbirth, and then looking at different interventions and using MR to be the biomarker to see which intervention performs better or not, especially in the first 2 years or first 1,000 days of life of a child. So I think that is huge impact, right? It's really solving a global health problem being used in that scenario. And as I said earlier when we started, right, 91% of the world doesn't have access to advanced imaging, and if we can make that possible through this device, that's our purpose.
Amazing. Nice to know more about all the things that you guys are doing. I think it's pretty interesting, and definitely gonna create an impact on the healthcare system, as you rightly mentioned. Thank you for joining us today.
You're most welcome. Thank you for inviting.
Yeah, thank you for sharing your mission and vision. I think
Absolutely.
it was pretty interesting, and I hope everybody learned a little more about the product, learned a little more about Hyperfine, what they're doing. I felt it interesting. So yeah, and
Thank you very much. Thank you.
thank you for your time.
Thank you.
Yeah.